Υπάρχει σήμερα ένας εναλλακτικός τρόπος καπνίσματος που να μειώνει τον κίνδυνο για τον καπνιστή?
So first of all, let me say that the best thing for a current adult smoker is to quit smoking, to reduce the adverse effect of smoking. Are there alternatives today? There are alternatives today that at the moment in the scientific assessment phase in two categories. They can be categorized in two categories. One is what we call the heat not burn products. These are products which still contain tobacco, but instead of burning the tobacco, like in a conventional cigarette, the tobacco is heated. And with this, you reduce the formation and therefore also the exposure to toxicants that are normally in cigarette smoke. The second category is what is nicotine-containing products, for example, e-cigarettes, which contain a liquid. This is composed of glycerin, nicotine, and, for example, flavors.
Υπάρχουν σήμερα επιστημονικά δεδομένα από μελέτες που να το αποδεικνύουν αυτό?
So for our products from Philip Morris International, we have 4 platforms, and all of them are in different stages of assessment, scientific assessment. Our platform 1, the tobacco heating system, we have submitted an application to the US Food and Drug Administration as a modified risk tobacco product. And for this platform, we have completed 17 non-clinical studies and 9 clinical studies. So there are scientific results. The approach that we have been taken and the standards that we have been using are, very much close to what is used in the pharmaceutical industry. Mainly what we do in terms of comparing, these products is we compare them, to what happens when people continue to smoke. And what happens when people stop smoking. Because when people smoke, this is the highest risk level that is there for smokers, versus when you stop, this is the lowest risk level and the best option, for current adult smokers. So the closer you are with your study results to what happens, when people stop smoking, the more confident you can be that your product, has the potential to reduce the risk of smoking-related diseases.
Αυτά τα επιστημονικά δεδομένα επιβεβαιώνονται από ανεξάρτητους φορείς κρατικούς ή μη?
Yes, there are studies from independent parties, and this is important, and we appreciate independent verification. These studies, have been done in various fields, for example, in the aerosol chemistry, in indoor air quality, but also in clinical, and they have been done by either independent researchers or, by organizations like Public Health England, for example, the US Food and Drug Administration, or the BFR in Germany. So yes, independent evidence exists, and it confirms, to our results that we have been, for example, submitted to the US FDA as well.